to start off, I would really love it if you could introduce yourself and maybe elaborate on what your role entails and everything.
Okay, I'm Shamla. I'm a lactation counselor. I got into this field about 7 years ago. I was a computer engineer. I'm a mother of two teenagers, and I think being a mother and not having the support that I wanted pushed me into becoming a lactation counselor.
Oh, wow.
So from computer science to lactation it's a completely two different tracks or extreme opposites. But if you look at it, what does my role entail? I'll tell you. First of all, I should say being a lactation counselor is very, very rewarding profession. When I hold a newborn baby in my hands and I know what I'm doing is going to set the path for the child for the rest of the life, right?
Yeah.
Imagine how rewarding it'll be. I in my head, I'm like, okay, it might not be all that glorious for a lot of people, but if I look at it, if I set the path right initially, that takes care of the health. Breastfeeding is not just about milk, it's not just about filling a baby's stomach. It is about nourishment, it is about security. The child feels a secure feeling, the bonding, the immunity set for life. When you're breastfeeding a child, it kind of reduces the chance of diabetes and cancer and blood pressure and all these for the rest of the life.
That's amazing.
So when I do something, when I hold a baby in my hand, newborn baby in my hands, and I'm going, this is the best start that I can give this child. I think it is the most rewarding experience anybody could have,
I,
right?
yes.
So I think that kind of puts me there. It is emotionally challenging because when a mother has had a baby, she's gone through physical changes,
Right.
hormonal changes, emotional changes based on how the delivery went. It could be a C-section, it could be a painful delivery. She's all over the place.
Right.
And you're dealing with a person who's like very emotionally charged. So it is challenging. I'm not going to say it is easy,
Right. Mhm.
right? It is very challenging. And if you're not a person who can take such emotionally challenging roles, then think twice. But it's great because it's flexible. It is not like a 9 to 5 job.
Right.
You're not going in the morning at 9 and coming back at 5. People that work in hospitals may still do that, but a lot of us have the flexibility of working from home. A lot of us connect with people all over the world
Wow.
looking for consultation. And it is flexible. It is sometimes I could have 3 calls back to back from 9 to 12, and then I'm free for the rest of the day. Or I might do a call at 6 a.m. and then I'm done for the day. And that 6 a.m. could be because it's in a different time zone,
Mhm.
right? So it is fairly flexible, and it is about continuous learning.
That's
There's
amazing.
a lot of, yeah, because it is paramedical field, right? And if you don't keep yourself up to date, what happens is you're not giving others the right information at the right time.
Mhm.
So you need to keep yourself up to date. You're constantly learning. Um, as for the actual role, we go in to see the parent. It could be a family. It could be like, just a couple. It could be just a mother. But what we need to do is assess the situation on how the mother feels, what is working, what's not working, how much of pain she is in. So we need assessment skills. We need education, as I said, constant education. We need to provide emotional support because the mother is going through so much emotions up and down. Um, Problem solving because unlike say um, a math teacher knows 2 plus 2 is 4, it can't be any other way, right? Whereas as a lactation counselor, we walk into the room, we see a mother and baby. It could be the exact same mother with the next baby and the situation could be different.
Right. Oh,
It could be a completely different problem altogether. And each mother, each baby, each combination comes with a different problem, and you need to have problem solving skills and quick thinking skills to know what is going on and to find a solution. So that is very, very important. And of course, the regular follow up, like if you're a doctor, a patient comes in to you with a problem and then you follow up to see how things are, right? So follow up and you keep records. So this is what my role would be, like to go and assess the situation, find what the actual problem is, solve that. And a lot of times it is counseling skills, emotional support. Many times the problem, the actual problem is not, a physical problem where the baby is struggling. It is the mother struggling because of all the emotional issues. So
Oh,
you're giving counseling as well. So all that put together, but it is rewarding at the end of the day.
oh wow. It's such and just such a respectable job you have, and it must be so amazing to hold the baby and
Yes.
just help the mother. That's such an amazing profession.
Thank you so much. Yes, it is. And it is, not everybody gets to hold a newborn baby, pretty much every day or every week kind of a thing.
Right.
And just so satisfying and so it's, I can't find words to explain how it feels.
Yeah, your story is so personally touching to me, and I know Bhumika as well, because our goal is to become an OBGYN and, hang out with
Oh,
babies all the time and everything. It's very special
lovely.
to our hearts. Yeah.
We'll keep in touch.
Definitely, definitely. And a follow-up question I had is like, if you have any advice for people who are trying to enter the field of lactation counseling, do you have any advice for them or specific lessons you've learned in your journey?
Definitely, as I said, while it is a very rewarding character, it's not for the faint-hearted
Right,
because you're dealing every single case you walk in, there's a problem you're trying to solve,
right,
right? You like, unlike a software engineer, you're not walking and going, yeah, I need to solve this. I have so much of a time. I can go trial and error. It is pretty much you walk in knowing fully well you have one or maybe two chances to get it right. And the mother might be going through postpartum depression. You're dealing with a lot of emotion. And a lot of times you need to keep in mind that it is not just the parent that you're dealing with,
right,
the cultural issues, the family, the support she has, like, physical support and doing things, or the emotional support that other people give her. So there's so much in the background. So if you're not a person who can deal with all this, then it becomes very, very difficult. So it is definitely not for the faint-hearted. First thing. The second thing I'd say is you need to keep yourself up to date constantly, 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 because this, like, as I said, I'm a mother of two teenagers myself, and one of my children has allergies, so I keep digging up research information, and recently I found out vitamin D deficiency causes allergies.
Oh,
So
really?
then, yeah, that's an interesting piece of information that I found out. And I dug up on research. There's more than one research that says that. So you need to know what research to believe in,
Mm,
right? There's plenty of information out there. You need to know what to follow, what is the right information, and how do you present it to your people. You need communication skills because you're talking to people, you're talking to a person who, like, your job involves talking with people constantly,
mhm.
right? So communication skills are very, very important. Um, and cultural sensitivity. Like, I deal with a lot of Indian mothers, but I have worked with French ladies, Italian ladies, Irish ladies. So the thing is, without knowing what their cultural background is, we cannot say that.
Right. Mhm.
So their cultural background might be, yeah, we have a baby and the baby stays in with us. Some mothers, some cultures, like say for the African culture, I find it amazing. They don't let the baby go. The baby is on their back. And I've always wondered, like, I feel like they're going to squish the baby, but they do it so well, so comfortable, and the baby is always calm because that's what their culture is.
Wow.
And if you look at Indian babies, like Indian babies are always held or were always held, though now the current story is that if you hold your baby too long, you get them used to it and you'll find it difficult kind
Wow.
of to wean them off that habit. And I keep fighting, saying, no, no, no. You hold your baby as long as you can because of whatever reason. Um, so you need to be like aware of the cultural sensitivity and know what to talk and what to say. So that is another thing. And of course, keep yourself trained constantly, like see whatever training you can get and clinical experience, because a lot now what has happened is you can do courses online, and with COVID, a lot of us do online support.
Right. Oh, okay.
So what happens is sometimes when you go and see someone face to face, you don't know how to do things. So
Oh,
if you can get that clinical experience, nothing like it. So go and get all the clinical experience. And when you go and get clinical experience, what happens is you're with other lactation counselors, other doctors, other people in the field that is going to teach you constantly.
mm,
And be in a support group of mentors who you can ask questions to, because none of us know everything all the time, right? So we go back and talk, we go back and ask questions and go, look, there is a case like this, and I need help. Always be open-minded. Don't let your ego stop you from helping others. So these are some of the things that I'd say. And network, like keep networking with professionals and be patient, because and empathetic. When you are with a family that has just had a baby, you're going through so many emotions. So if you're not patient and empathetic, it is you're not going to succeed in your field.
right. Those are all such great pieces of advice, and I'll definitely try to incorporate them. Like, for example, I really liked your piece of advice on empathy because I feel like a lot of healthcare professionals, they might not be as empathetic as they should be. And so we're definitely going to try to increase our empathy and also understand people's culture and everything.
Yeah, I think that is very, very important because we don't live where we are born anymore. Like the whole world has become like one small village, and we connect with people who are from different cultures all the time. And I think we need to consider when a mother says, I can't do this because my family will not accept it. We need to be empathetic. We need to understand she would want to do it, but she can't do it for whatever reason. Either find a way for her to do it, talk to the family to see if you can get support, or find an alternative.
Right.
There are different ways of dealing with it. As I said, problem solving skills. You look at it and go, what can I do to make the life of this mother better?
Yes, and I have one question about that. And so
Yeah.
I know that, as you said, the world is a village because, it's very globalized now. And so
Yeah.
I wanted to ask you if you have any advice on becoming more knowledgeable about different cultures, because I know there are lots of cultures. And so I
Yes.
wanted to ask you, how would you recommend learning about other people's cultures?
Usually what happens is I, as a person, travel quite a bit. As an individual, I travel quite a bit. And I've visited more than 35 countries. And I have friends from, I don't know how many countries. Like I have friends from all over the world, which teaches me, I make sure when I talk to people, like keep an open mind. And I try to find connections. I go, like when I walk into a room where the mothers or the families from a different culture, I try to talk to them and find out, oh, how did your birth go? And what do you normally eat, during your pregnancy or before you give birth? Like some cultures insist on eating certain food in the last month or whatever. And I'd ask, what was your last meal and what is going to be your first meal after labor? Because that again varies from culture to culture.
Right.
So when you start talking, when you start connecting, food is something that opens up a lot of people,
Right.
right? So then you ask about that, and then you start like, if you don't know anything about that culture, it's okay. You can still walk into the room with a smile, accept saying, it's interesting. I've never met a person from X country before, and I'm really curious. And I want to learn. And this is what you can also say. This is what we do in our culture. So that helps them open up a bit more. So I say, look, when I had my babies, I had them in Ireland, and the first food that we got was toast and tea. And I can assure you that was the best tasting toast and tea ever, kind of a thing. And that makes them smile automatically. And like whatever pain they are in, that makes them smile, that brings a smile to their face. And they automatically open up, going, oh, you know, the hospital gave me this food to eat and it was horrible, or my mother brought me this food to eat, or whatever. And once that opens up, it is easy. Once a connection is made, right, it is easy for you to ask more questions and learn. And even among the same culture, you'll feel like, even in India, for example, the south is different from the north, what people do here is different from there. So it is always better to ask. If you don't know, just be honest and say, I don't know how you do things in your family or in your culture or in your city, so how do you do things? So that kind of opens up a whole world for you to understand, and you will find that you get amazing answers.
That's amazing. Yes, because we volunteer at the hospital and we always meet people from all different countries and areas, and I'll definitely start asking them more about their culture because it's very interesting.
And you'll be surprised. There are lots of times when you start connecting with people and somebody would have brought food from home and you'd be offered the food.
Oh,
And
wow.
it comes from a place of love,
Yeah.
right? And it shows their appreciation for what you've done for them or what you're doing for them. And they'll say, this is from my country, or this is what my mother made. Would you like to taste? And it's up to you whether you taste it or not. But uh, you will find things open up. And I've got like random things from random people because they want to show all the love to you because you've supported them in the most difficult time.
Right. That's so sweet. Yes, wonderful advice. I really loved your advice specifically on, staying curious, asking questions, and always having an optimistic and open mindset.
Open
It's
mind, yeah.
very, very important. Yeah, that brings me to a follow-up question. I'm wondering if you had any, mentors or specific people that really helped you get into lactation counseling or helped you like pursue the career in general.
See, what had happened was when I had my son, there was very little help. And between having my son and daughter, which was 23 months, I got on, like, Facebook was very new then. There was a group called Extended Breastfeeding Support of Ireland. So
Oh,
I got onto that. And then there was a group in India, and there were a few women I met as a part of the group, amazing women who kind of guided me along the path.
wow.
Uh, so it is like, I should say, the universe brought it to me that I met these amazing women over the period of years. Like, it's on and off. We meet once in a few years, whatever. But these women kind of went, you know what, if you're interested in this, this is what you do. Um, and that kind of helped me. So I spoke to people, I spoke to different people. I found out about the courses, and somebody got me into the Lactation League International as a leader. So it was like women, women support, the sisterhood, the
Wow.
support from the sisterhood from around the world.
Oh, wow. That's amazing.
Uh,
And
uh,
another question I had, so it's a follow-up question, but another question I had was, were these women, did they help you transition from your different jobs? Because I know you were in IT before you went into lactation counseling.
What had happened was when I had my son and he had allergies, I found out he had allergies. I decided to quit my job, take a break. I had my daughter. So when I was pregnant with my daughter, I quit my job. But I was doing other things. I used to write blogs and I used to do content writing and I used to, support other, like I volunteered as well in loads of different organizations.
Oh, nice.
So then I had a break. So when the lactation profession, like when I started looking at it, I went, these women kind of, yes, they supported me in getting on board. And what I find is there are some, I like, I don't, I don't know exactly how it works in the sense that we do have engineers and we do, like I am in my college group still, and we do support each other. But the lactation profession, if you look at it, we have support groups and we ask each other questions. And I go like when I had to learn something, I'd go and ask someone. And when someone has, like, for example, 2 days ago, somebody came to me, had posted in the group saying, what do you do in case of lactose intolerance and breastfeeding? And I knew the answer straight away because my son had both lactose intolerance and CMPA.
Uh,
So then I got on a call, explained the whole thing to her. And she went, oh my God, I didn't realize there was so much information behind it. So we support each other.
nice. That's beautiful.
And I think that support is important because I've helped so many mothers with who have babies with lactose intolerance overcome that hurdle, continue to breastfeed for years together.
Wow. That's am-
Um, so then it is like when it is not like everybody can know everything. I know a friend of mine, she's fantastic at induced lactation.
oh, interesting.
So then, like if I know anybody that's looking for induced lactation or relactation, I send them to her and say, "Oh, go and check out Varsha. She does an amazing job at this." So we all support each other. There's no competition.
Right.
So it is like, I'm good at this. I can take care of this. She's good at that, and you can get help from her for that, or you can get help from this woman for this. So it is a lovely, amazing network, and we all support each other. So the ultimate goal is to support the parent.
Right. That's beautiful. And I actually had a few questions because I'm curious, but I was wondering if a baby is lactose intolerant, how does breastfeeding work then?
Fantastic, amazing question. See, most babies are, as far as I know, unless and until there's primary lactose intolerance, which is very, very rare in babies, usually what babies have is secondary lactose intolerance.
Oh,
Secondary lactose intolerance can happen because of two reasons. One, antibiotics.
mm,
What do antibiotics do? They kill bacteria.
mhm.
And the antibiotic that goes in does not recognize between good bacteria and bad bacteria.
Right.
Right? So if the mother is given antibiotic or the baby is given an antibiotic, either ways, the damage could happen.
Right.
Or there is a stomach infection where there's bad bacteria getting in and damaging the good bacteria,
Oh,
right? So lactose intolerance, lactose is a sugar in breast milk. And when the baby is unable to digest the sugar, that is where the problem comes in. The baby is pooping after every feed. You can find it by doing a stool test where it shows reducing substances as positive. So you know what the baby is lactose intolerant. So there are two things happening in case of lactose intolerance. One, the lactase enzyme, which digests the lactose itself, is reduced.
oh,
Okay. The second thing that happens is the good bacteria is gone
mm.
or reduced to a great extent. So what we do is we ask the mother to continue breastfeeding. Don't stop breastfeeding. Start the baby on lactase enzyme.
Oh, okay.
You get lactase enzyme as drops. So you start the baby on lactase enzyme and probiotics at the same time.
Mm.
And within 3 days, the baby will be fine.
Oh, wow, 3 days.
3 days.
Wow. That's amazing.
Yeah, unfortunately, though, a lot of doctors are yet to update themselves on this. So they keep saying lactose intolerance, go to a soy formula, go to soy milk or something else which doesn't have lactose, because any mammal milk is going to have lactose. So they either go to hydrolyzed formula or soy milk or soy-based formula kind of a thing, which is unnecessary.
Right. Wow,
So
that's amazing. Wow. And another question I had about that was, so I know you mentioned that you put the baby on probiotics. And so
yeah,
I was wondering, what are probiotics? I've heard of it, I've never asked about it though.
okay. So there's probiotics as bacteria. Like, you're going to be doctor, so you know our body is made of bacteria,
Yes.
right? So probiotics are the good bacteria,
Mhm.
like lactobacillus. There are different strains of good bacteria. And in this case, usually what we give is lactobacillus, right?
Okay.
So one thing is, when a baby is born, the baby gets the microbiome. If it's through the vaginal delivery, it's through the vagina, the vaginal bacteria, the baby gets the vaginal bacteria, the baby gets bacteria from the mother's fecal thing as well. And from skin to skin, the bacteria from the skin, that sets up the baby for life. So when a baby has a vaginal birth, when a mother has a vaginal birth, the microbiome is set for the baby,
Oh, wow.
right? Which doesn't happen in the case of a C-section.
Mhm.
So at the moment, what they do is they do vaginal swabs very rarely. Not every hospital does this, but they do vaginal swabs and put it on the baby. And we also recommend that the baby is not bathed for at least 24 to 48 hours, so that the baby's, um, the microbiome is maintained.
Right. Wow.
Don't wash the baby straight away, which was what we used to do earlier. Now we go delayed bath, very important, and put the baby on the mother's chest, skin to skin, so the baby gets more good bacteria in. So all this, constitutes the good bacteria that goes in. So if you see, there are prebiotics and probiotics. Prebiotics feed the probiotics.
Oh, interesting. That is so cool.
Okay.
Yeah.
So prebiotics are like food with fiber, or onion and garlic would all be prebiotics. They will feed all the good bacteria in your gut.
Oh.
So usually they ask you to take a combination of prebiotics and probiotics.
Mm.
To maintain the gut bacteria, you need to take both.
That makes
Your probiotic food could be curd, regular curd or yogurt that we have, um, kimchi,
oh,
sauerkraut, kefir.
I've never heard
Um,
that.
you've never heard of kefir, no?
I have not.
Okay, kefir is like yogurt. It is, you can have water kefir and milk kefir. You have starter grains, which are live cultures. So you add them to milk and wait for it to ferment, and then strain out the starter and add the starter to fresh milk. And you use whatever, like buttermilk or curd, right? So that is full of all the good bacteria. You can also use kombucha. Kombucha is probiotic, if you've heard. So all these fermented food, they're all probiotics.
That's amazing. I was never aware of how important healthy bacteria and probiotics is for individuals and babies, but that's amazing. Yeah.
And I'll tell you something. If anybody has IBS, kombucha is recommended, because that helps, kombucha and kefir properly, that helps with healing the gut.
Wow. What is IBS?
Irritable bowel syndrome.
Oh, okay.
So a lot of your gut issues can be solved, even allergies can be solved by taking probiotics.
Oh,
So
wow.
great.
That is so cool. I definitely underestimated the importance of like diverse microbes in our
Yeah,
bodies. I definitely need to add more diversity to my diet after
that,
If you don't mind, can I ask you one last question?
yes, go ahead.
Yeah, so my last question is if you could meet with any person, past or present, who would it be and why?
I'll tell you what, Maya Angelou.
Oh, Maya Angelou. What a beautiful.
Yeah, I wish she was alive. I wish I could go and meet her. See, I've been lucky enough to meet a lot of people that, other people wouldn't have met. I've actually seen face to face. I've seen Nelson Mandela. I've seen
Oh,
Muhammad Ali. I've seen people that others would have dreamt of. But Maya Angelou is one person who, unfortunately, I can't see her in this lifetime. But yeah, she is, for the work that she did, her wisdom, amazing. Like, that is a woman I admire.
I completely agree. Yes, I think I read a poem about her in school called Until I Rise. I'm not sure, but it was a beautiful poem and I love her wisdom in writing, like you said. Yeah.
And she's an activist. And
Oh,
like, there is so much. She's a very powerful woman, and she's like unparalleled. God, like I think in the recent times, she's a woman that I look up to.
yes, beautiful. Especially for like empowerment of women and just
Yes,
individuals in general. So
yes.
yes. Yeah, well, that's all the questions I have. It was so incredible to meet you and learn more about lactation counseling, especially since I've never met anyone who's a lactation counselor, and that's just so amazing to me. Yes, it's such an amazing profession, and that's definitely something I want to look into when I'm growing up.
Thank you so much. And I'll tell you what, good luck with whatever you're doing. You both are doing an amazing job interviewing people and getting this all out because a lot of young generation need this kind of a guidance.
Right.
I feel because people don't know there's so much that they can do um, beyond the general, being if it's a medical profession, it's usually a doctor, a nurse, a physiotherapist, or it is very limited circle. So there's so much more to do beyond that.
Yes, definitely. Yes, I would definitely love to stay in touch with you because you're such
Definitely.
a nice woman and I look up to you. So thank you so much.
Thank you so much. Yes, please do stay in touch. And I'd love to see you both as Afghans. And, I'd love to be a part of your journey. Thank
Thank,
you so much for giving me this opportunity.
thank you so much. It's my honor and pleasure.